Modern healthcare is becoming increasingly complex thanks to advancing technologies as well as increasingly nuanced and complicated regulatory and policy frameworks. The BioMed Alliance has a unique opportunity to bring together a variety of clinical specialisms so that we can share experience and bring a single voice to policy making when it's happening in Brussels in order to share our views and perspectives to make sure that we can ensure the best outcomes for our patients and for clinical care.
I think the most important part for the expert in the expert panel is that when they advise on a product, they should advise mainly in the area of their main expertise. This is important because the dossier that they're going to look at is related to a potential new implant and a potential risk factor for the patients. And if they, from their expertise, know that an implant potentially can have a risk factor, they should post this on to the notified body.
Since COVID, we've learned that there's definitely a European dimension to healthcare, although we all know, and it will remain this way, that health is a member state sovereign issue. And at BioMed Alliance, we would like to be constructive actors in making sure that the rules and regulations that we have to observe are those that our patients need and that our healthcare professionals will apply because they make sense to them. Now that means that we train a small but appropriate number of specialists who are regulatory competent, not just to understand, but also to be able to impact on making sure that the regulations that we are progressively developing are fit for purpose. So at BioMed Alliance, it's a priority for us to make sure that these people who really are still involved in optimal state-of-the-art care within the medical specialties, to make them capable of getting our messages across in such a way that the policy officers understand them and that they can then be enacted or implemented as the European health space is coming into being.
Medical societies can find experts that join the European Medicines Agency panels, and through there they can help shape what would be the future of pharmaceuticals and perhaps also medical devices. But they can also start conversations with the European Commission, become experts there as well, and basically put the voice of their specialty into the EU. Otherwise, this voice will never be heard. It takes time and it seems like it's difficult. But if you want to get change in all the problems that you have at the medical level, you will really need to get engaged. I mean, you need to take serious what is happening here at the EU level because it has a lot of effect on what you do on your daily basis.